I did my research project on the effects of maternal caffeine consumption during pregnancy. The reason I chose this topic is because I wanted to research something within the OB specialty of nursing. As you may know, caffeine is a legal stimulant that raises the heart rate and blood pressure. Many people consume caffeine in coffee, tea, or soda. In pregnant women, caffeine crosses the placenta. It is important to research this topic because of the possible negative effects caffeine can have on fetal development. A lot of pregnant women need educated on what is safe for their baby, especially if it is their first child and they don't have any experience with pregnancy before. They often rely on healthcare professionals, such as nurses, to educate them and be there for them when they have any questions. We know that they should avoid smoking and drugs and drinking alcohol due to the harm to the baby, but there is less research out there on caffeine, which is a commonly consumed substance. If a woman drinks a lot of caffeine, it would be important for her to be educated on whether this habit is safe for her child during pregnancy or if it will affect the child's development. Some studies have shown the risks of increased caffeine intake during pregnancy include a higher risk of miscarriage and a low birth weight for the infant. Due to these risks, these women may have to adjust their lifestyle during their pregnancy. So for the clinical problem, it is important for expectant mothers to know if the ingestion of caffeine is safe, if there is an appropriate limit, or if it is contraindicated and can cause harm to the development of the fetus. The nurse should educate the patient on caffeine and its actions within the body, as well as the amount of caffeine in typical foods or drinks containing the substance, such as coffee, tea, or energy drinks, or soda, or even chocolate. These are the components that make up my PICO question. The patient population includes pregnant women. The intervention is the consumption of caffeine during pregnancy, which is being compared to the absence of caffeine during pregnancy. And the outcome is to determine if the caffeine consumption by the mother during her pregnancy has negative effects on her baby. So my PICO question is, does the consumption of caffeine have negative effects on the development of the fetus in pregnant women compared to the effects of not consuming caffeine during pregnancy? When I was researching articles, I used the Penn State Library's Lion Search. I also used ProQuest, which is where I actually found a lot of my articles. The librarian helped me when I went to see her because at first a lot of the articles I had found were review articles, so they actually didn't qualify for this assignment. And so the articles had to be within 5 years of being published, they had to be in the English language, and they had to be peer reviewed. They also had to be either qualitative or quantitative, and I ended up finding 4 quantitative studies to use. I used keywords to search, such as caffeine, pregnancy, nursing, and development. I also used the word "and" to combine some of the words so that I could find more relevant articles. And then once I found them, I went through them and I looked at the abstract and their research, and I just wanted to see which ones would fit my topic best, and then I ended up finding the articles that I used. So for the similarities within my research studies, a major one was that all of the studies were quantitative and they were also quasi-experimental. All of the studies, so they would send out a questionnaire to the mothers in order to collect the data. So the reason that the researchers used similar methods in all of these studies is because it would not be considered ethical to perform controlled experiments on pregnant women, because this would not only pose a health risk to them, but also to their developing child. And as we talked about in class, pregnant women are a vulnerable population within research. So because of these ethics, the mothers were not assigned any certain amount of caffeine to take in. It was just they reported the amount that they consumed on their own. And many of the questionnaires that they had broke the caffeine intake down into different categories. And this would allow for an accurate assessment of the amount, type, and frequency of the caffeine that the mothers consumed. And Article 1 and 3 use the Kruskal-Wallis test in their statistical analysis, and Article 1 and 4 use the SAS software. While all of the research studies were investigating the effects of maternal caffeine intake and pregnancy outcomes, several focused their research on different possible outcomes. So, for example, Article 1 investigated the possible outcome of preterm births and size for gestational age, whether the babies were small or large. Article 2 investigated the possible risk of miscarriage in relation to the maternal caffeine intake. Article 3 investigated the length of gestation and also the birth weight of the infant. And Article 4 investigated the IQ of the child when the child turned 5.5 based on the maternal caffeine intake. So for some more differences within the research articles, Article 2 used only pregnant women who were nurses, and no other study used a specific occupation. And when using such a specific career, like only using nurses, it makes the results harder to generalize to women that have other occupations. And another thing that Article 2 did differently was that it excluded women who had suffered a previous miscarriage. And so because there are many reasons a miscarriage can occur, using these women who already experienced one could alter the results of this study, whether the caffeine was affecting it or not. And for Article 4, they examined not only the caffeine intake during pregnancy, but also the outcome of the maternal caffeine intake prior to the conception of the fetus. And the reason that is different is because all of the other research studies focused only on collecting data about the intake only during the pregnancy. And another way they collected their data was different, because along with self-report, they also analyzed the medical records of the women, which gave a more objective result than just relying on self-report. So, my PICO question was, does the consumption of caffeine have negative effects on the development of the fetus in pregnant women compared to the effects of not consuming caffeine during pregnancy? And I think that in order to fully answer this PICO question, there needs to be more research out there. There isn't a whole lot of research out there, and that's mostly because of ethics, as I mentioned before. There are some research articles out there that have animal studies to try to get around that ethical dilemma, but the research that I did find suggested that the consumption of greater than or equal to 4 servings of caffeine each day before pregnancy was linked to an increased risk of miscarriage, and this was especially true at gestational weeks of 8 through 19. Another study found that caffeine intake is associated with longer gestation and a decreased infant birth weight. And the week that the caffeine had a more profound impact in this study was 17 weeks. And one last study showed that children whose mothers consumed greater than or equal to 200 milligrams of caffeine per day had significantly lower scores on their IQ test and were at a higher chance of having borderline to lower intellectual functioning with an IQ of less than 85 than the children of mothers that consumed less than 100 milligrams per day of caffeine. So the reason that these findings are significant to nursing all stems back to what I said about patient education with OB patients. That's a really important part of their care. So this supports the nurse's role of patient educator with information to teach their patients. And often these OB patients, they will have a lot of questions concerning their pregnancy and what is safe, what is not safe. It can be something that's very new to them, and so they need a lot of guidance. So they can be applied in teaching pregnant patients what is safe in regards to their caffeine consumption while they're pregnant. So how much is safe? Should it be avoided at all? And what items have caffeine in them? The nurse is able to teach the patient all about that. And considering the findings from these studies, the nurse is able to back this up with the adverse effects that can happen because of the caffeine. And as I mentioned before, that can include a risk of miscarriage, having children with lower IQ scores, and having lower birth weight infants. So when the patients are educated, they have a greater chance of keeping their children safe and making more educated decisions. So this is just a list of my references. Thank you for listening.